Let's turn our attention now back once again to coronavirus, and let's talk to the Health Secretary, Matt Hancock, who joins us. Good morning to you.
Good morning.
Good morning. Well, yesterday we had the COBRA meeting chaired by the Prime Minister, which you've agreed to an action plan on how to tackle coronavirus. It seems to include having volunteers helping to man the NHS. It's a little bit of a worry, isn't it?
No, we already have many volunteers in the NHS. In fact, the second biggest group of people working in the NHS after nurses are volunteers, and that's great for normal times. But of course, in one of the challenges, if this coronavirus goes widespread, becomes pandemic, one of the challenges will be having enough people to look after people who are sick, and therefore using volunteers, encouraging volunteers who currently play such an important role, doing the right things, of course, doing things that, you can't ask volunteers to do things that you need clinicians to do, but helping support people in the NHS, that'll be one. It's just one strand. You picked one strand.
Yes.
I think it's important, but it is one strand of a broad action plan for how we contain the virus now, whilst the number of cases is relatively small and we're trying to stop it becoming widespread, but then also the sorts of things we will have to do and have to consider if it becomes widespread.
But you've said if a couple of times there. I mean, we are looking at 39 confirmed cases here in the UK. France, 191 and 3 deaths. Italy, almost 1,700, a 50% rise over the weekend and 34 deaths. Given the close links with both those countries, it does seem to be more likely to be a matter of when, not if. Should we perhaps have taken more precautions earlier? There's always a trade-off when you do this, and there's an economic hit compared with the risk to the health of the nation as well. But should we perhaps have been instituting more controls earlier on people who may have been to Wuhan, to other affected areas, long before we actually did?
Well, we have been putting in controls that are guided by what is scientifically effective. What I don't want to do is put in place things that don't have any clinical impact, any impact on slowing the spread of the virus, but are very disruptive. But what I do want to do is do things that help slow the spread of the virus, preferably stop the spread of the virus, and the lower impact they are, the better in terms of the impact on the rest of your life. So, for instance, washing your hands has no disruption to the rest of your life, but it has a very high impact in terms of slowing the spread of the virus. We talked on this program a couple of weeks ago about whether to stop all the flights from China when it was very much a China-based thing. Well, the only country in Europe that stopped the flights was Italy. And in advance, the clinicians, the epidemiologists, just said to me, won't work because this virus will find other ways to transmit. And I think the evidence of what the Italians did and then what happened in Italy proves that they were right. So we'll be guided by the science. I'm not afraid to take some quite serious action. And the reason we're setting out this plan today, both for the contain phase and then to delay and to do the research we need and to mitigate, it's a 4-part plan. The reason we're setting it out, including some of those actions that we might have to take, is so that the public is aware of what could be coming and isn't surprised if we have to do some of the more difficult things that you wouldn't normally do as a government.
And we are looking at some extra sort of emergency powers involving, going much further than the NHS, for which you're responsible, the policing of quarantining, closing schools, offices. Could we see a situation where public transport will be closed down, as we've seen in Wuhan?
Well, we are looking at taking some extra powers. Mostly the powers are about enabling things to happen.
Apologies, we've got the line seems to be a little bit. So apologies, Mr. Hancock. The line has been a bit fuzzy there.
Mostly it's about enabling public services to continue functioning in unusual circumstances. So, for instance, the laws about the ratio between children and
teachers
and adults in childcare settings, exactly. And relaxing those in case there is a shortage of teachers, because if there's a lot of people who are ill. Likewise, giving extra powers to border officers. Currently, the powers that we to allow the police to enforce self-isolation, to enforce isolation and quarantine, they don't apply to border officers. I think it's reasonable that border officers who are policing our border are able to have those powers too. So it's more about enabling us to, just to have as much normal life carry on as possible. Yeah.
But realistically, we are going to be looking at sort of like following the suit from France and other countries where major events involving thousands of people are not going to be able to go ahead. Football matches, rugby matches, like played behind closed doors in empty stadiums?
Well, I don't rule that out. I don't rule it out, but we're also clear that we do not recommend that now. And we're some weeks off the time when that might be required, according to the science. Because I want to minimise the disruption, the economic hit, the social disruption. But the top task is to keep people safe.
Well, again, but there is a trade-off there. That's the key issue, isn't there? And that's a trade-off also lots of individuals are having to make. And I raised this with you last week, and I think it's more of a concern for a lot of people now who are coming into contact with people who may have got coronavirus. They're perfectly well themselves, don't feel ill at all, but they're being told to self-isolate. And that's all very well. Let's say if you've got someone who'll pay your sick pay, you can carry on, good employer. But a lot of people are freelance, a lot of people on low incomes, jobs they have to turn up to, they can't work from home. Are we not in a situation where we are making it very difficult for people to self-isolate who are in very insecure work and low-paid work? Should we not make sure that all of those people are entitled to sick pay?
Well, you did raise this with me last week, and it's very clear. The rules are very clear, which is that if you're self-isolating for medical reasons, then that counts as being sick for the purposes of the sick pay regime. Now, we keep all of this under review, and it's something that I'm talking to the
but someone who is freelance, someone who's on a 0 hours contract, somebody who is a contractor, they're not entitled to sick pay right now, even if they are very sick. They're certainly not entitled to if they're self-isolating without being sick. There are millions of people in this country who may be told, for the good of the society, good of the community, of their fellow workers, to self-isolate, who won't be able to pay their rent. That's not fair, is it?
Well, I understand that. And as I say, we're keeping the system under review, and it's something that I'm talking to the Welfare Secretary about. But we have got a robust system of sick pay in this country, and of making sure that everybody can always get support if they're in very difficult circumstances.
Okay.
But of course, it's an important consideration, because if people are ill, then we do want them to self-isolate and not to infect others.
Yeah, well, again, but we're talking about people who aren't ill. That's my point. And again, it seems to me that this is the point when we need people to be self-isolating to keep the rest of society safe. And we're asking some of those people in very precarious, low-paid employment risk losing their job, to not be able to put food on the table for their kids, not entitled to sick pay. And we're asking them to make a sacrifice to the rest of us. Should we not be saying, right now, if you're in that situation, you will be entitled to sick pay?
We are not asking them to put their job at risk, because self-isolation counts as being sick if it's done for medical reasons, which, of course, in these circumstances, it is. So, the system is robust to that, because it's set up so that if you're self-isolating and you can self-declare that self-isolation, and that allows then the statutory sick pay system kicks in.
Okay, well, I've repeated myself many times. Lots of people aren't entitled to statutory sick pay. Let's come back to the Home Secretary, though, Priti Patel. She's facing an awful lot of pressure after the resignation of Sir Philip Rutnam, the Permanent Secretary at the Home Office, at the weekend. Another allegation coming out today about when she was an Employment Minister, and allegations that somebody was given a payoff. Again, no one's quite sure how these documents have emerged, since only the lawyers should still have access to this non-disclosure agreement that's been signed, and a £25,000 payoff. Can Priti Patel survive this onslaught? Wherever it's coming from, somebody wants her out of that job. Can she survive as Home Secretary?
Well, yes. I mean, Priti is a very determined Home Secretary, and I think that's a good thing. She's very keen to drive through the agenda on which we were elected. She's also very courteous. You know, I've worked with Priti for a long time, and I've never seen anything other than a courteous, kind approach. So, look, there's a process in place to deal with the allegations. There's also potential legal action in the offing. So I can't go into the details of any of the individual points, and you wouldn't expect me to. But there is that process, and I think we should allow it to run its course.
Do you think that she is just facing a deliberate attempt by senior figures in the civil service to undermine her and to oust her?
Well, I'm not going to go into any of that. And as you can imagine, I've been concentrating entirely on coronavirus. But I know that there's a process that's been put in place, and I think we should allow that to go through.
Okay, all right. Just one final question on coronavirus. Given there's photographs of Angela Merkel with a colleague the weekend yesterday who refused to shake her hand, are you still shaking hands with people?
Well, I took advice on this yesterday from the medics. And they say that the impact of handshaking is negligible so long as you wash your hands with soap, preferably hot water, for 20 seconds.
Straight afterwards?
Regularly, much more regularly than you normally would. Yeah.
All right, then.
That's the thing to do. Wash your hands. Are you washing your hands?
No, they're virtually raw with hand washing at the moment. Yes, I'm being a very good girl.